Hi, this is Dr. Kendra Outler with Uzima Health and Wellness, and I want to welcome to the show tonight author and mother Tyrene Gibson, and I'd also like to welcome another outstanding guest, Miss Erika Young Lee, and we are coming together to talk about sickle cell anemia. These are women who are brave warriors. They live have experienced sickle cell anemia for themselves. And they shared their stories with me. I think that both of them walked up to me and bravely said, "Hey, I either have a story I want to share with you as a health and disparity expert. This is something that I feel passionate about. I feel that we need more messengers out there talking about my life and my struggle." And I listened. And I listened because I'm a physician who cares deeply about her patients. I'm a physician who is very interested in health disparities. So I want to thank both Ms. Lee and Ms. Gibson for talking to me and trusting that I would take their cause very seriously. Ms. Erika Young Lee is a wonderful bioscientist for a major corporation here in the DMV area. And she's also a proud Morgan State graduate. So I'm going to put a spotlight on you.
Hey.
Okay, Tyrene, we'll be right back. But I want to put a spotlight on our Morgan State graduate right quick. And you are a class of 1995, right?
Yes, I am.
Okay, now let me add. I had to give you that shout out right quick.
Thank
And
you.
Ms. Gibson again has some relations to Morgan State as well. She's an author, a book of Mothering the Crescent Moons. But I'm going to start with you, Ms. Lee. I want to start with you and some stories in terms of just coming of age with sickle cell disease and anemia. My question to you is, when did you learn that you had sickle cell?
Ooh, I'm going to say 5. My parents didn't know at birth.
Mm-hmm.
And they would, they told me what I had, what it was. But
Mm-hmm.
don't forget that was in the 70s. So the
Mm-hmm.
world was different. Um, and one of my pediatricians would let me see my blood in the microscope.
Mm-hmm.
So I was able to actually see the regular healthy brown cells compared to the sickle cells.
Mm-hmm.
So that was really my first.
What hospital was that they allow for you to have that type of interaction? That's amazing to me.
It was not a hospital. It was a private practice.
Okay.
Um, and it was really interesting.
Mm-hmm. Mm-hmm.
But that was all we knew. We never knew anyone else
Mm-hmm.
that had sickle cell disease. My parents, of course, did not know they had the trait.
Mm-hmm.
During their day, they were not testing. So we found out they had the trait based on me having the disease. And I have one sibling, and he's completely AA. He's not, he doesn't have the trait at all.
Mm-hmm. So the question is, you said in the 70s. I thought we were testing, but again, I think every it wasn't mandatory. Every facility was not testing. Where are you from?
Philadelphia.
You're from Philly, okay. And
Yeah.
there's a large sickle cell anemia population there because we have a large group of large Black American population in Philly.
Right.
We call Atlanta Chocolate City, and we call Philadelphia the City of Love, right?
Yes.
So tell me about Morgan State, and did you? I mean, growing up as a child, did you have frequent contacts with the healthcare system?
I did not.
Wow.
Um, there were times that I was in pain,
Mm-hmm.
but it was light pain. And because we weren't as familiar, uh, like I had never gone to the emergency room,
Mm-hmm.
we didn't think about it. But the precautions that my parents took, they allowed me to do everything in limits. I was still a cheerleader. I couldn't run track, but they felt let me do what I can do, and my body would tell me. It was not until I attended Morgan State, which my father, he did, he put a 2 hour distance on me in terms of school. I knew I wanted to go to an HBCU, and he said, all right, 2 hours, any direction you could go, but that they would have to uh, be able to get to me in a reasonable time. Of course, first semester, I'm put on bed rest. I had never been on bed rest before. Of course, I did not call home to tell them that I was on bed rest. Um, we had a wonderful pediatrician at Morgan, Dr.
Mhm.
He went by Dr. Z. His
Mhm.
name is Dr. Zollicoffer. I
Yeah,
hope
I read Michael Zollifer.
yes.
Okay.
He was the first African American doctor that I ever.
Mhm. Mhm.
He educated me more on the disease. He was the only physician to tell me that I still had a good percentage of my fetal hemoglobin left.
Mhm. Mhm.
At that time, it was like between 12 and 14%,
Mhm.
which he was surprised. Fetal hemoglobin is essentially a baby hemoglobin that's more enriched in oxygen,
Mhm.
and you lose it early in life, and still as a child. So for me to have a high percentage of it left,
Mhm.
being 18 years old, he was saying that may have helped me do as well as I have done.
Mhm. That is awesome. So you, because you had seen your cells as a child, you kind of knew already what that meant. That when he was trying to describe it to you, now that you're at Morgan State, and to have a pediatrician on campus, I mean a physician on campus, explain your disease and why you were feeling the way you were. Did they talk to you about the correlation between stress, maybe as a college student, and activation of these symptoms that you said you really didn't have so much of as a child?
Yes, he and his team really did the most education of the disease for me. Um, and then I found out how the temperature, a big shift in temperature,
Mhm.
I see you, Tyrene,
Ah.
will cause pain. You figure I'm a freshman in school. Yeah, I like to go out as well.
Mhm.
Often, say the parties, you may not, there at night, you come home early in the morning, you may not wrap up as
Mhm.
much as you should.
Mhm.
It's a big temperature fluctuation from when you left to go out to the party
Mhm.
to when you come home. And he was able to explain that to me, how that will not work for you.
Mhm. So you felt supported at Morgan State during your colleges. You felt like, here I am, I have someone that's paying attention to me, and that allowed for you to complete Morgan State, and you actually graduated with a degree in biology.
Yes.
Now, did you pick that major because of your illness?
Yes, but I was always interested in science, especially as a child, being able to see the cells myself. The high school I went to, I was in a science magnet program.
Mhm.
And then when I got to Morgan, right? And truthfully, it was a toss up between political science and biology. But because of my high school,
Mhm.
math and science was easier for me. The topic was easier.
Okay. And then from Morgan State, you went on to get your master's as well, and then into the corporate arena as a biomedical scientist. Is that right?
Well, as a microbiologist,
Yes, that's what we call it.
my first job out of school,
Mhm.
I actually did more micro work.
Uh-huh. Uh-huh.
As my career progressed, I was more in quality assurance,
Mhm.
uh, and now I'm a senior quality engineer.
Senior quality engineer. That is outstanding. And how's your career been?
It's been interesting.
I call smart Black girls with rules. We say, I think that's outstanding to know, number one, that you're in this. You took your science background and merged it with corporate America. I think sometimes we don't know that can exist.
Right.
And you said something so sweet to me when we met for the David Satcher Living Legends Ball, and you said, I got married, and tell us about that. You're so happy about that, and I really want to emphasize, because for sickle cell patients, and their families, they're one of the things you want to see them go through these stages of life. We all know that there's a high risk of not having longevity. And so we just want to celebrate you for basically, going to college, master's of corporate America, and you are Mrs. Erika Lee.
Well, going back to Morgan State University, besides having a good health team, I had the best friends. HBCUs,
Oh,
they teach you to have each other's back.
uh-huh.
So when I was on bed rest or if I wasn't feeling good, friends of mine, roommates, they would go pick up food for me, bring
Uh-huh.
it back to the room. And once again, this is the 90s. Everything wasn't as convenient as it is now.
That's right. No Uber Eats.
Right.
Right. And who had money for that?
Yes, exactly.
But to also tie into the marriage piece and Morgan State University, my husband also went to Morgan State
Oh,
University.
wonderful.
Oh,
But we didn't know each other at the time.
That alumni draw is very strong and bonding, right?
Yes. And when I say a good support system,
Mm-hmm.
he truly has my back and my family's back. And I appreciate that.
That is outstanding. And so, speaking to a mom who's looking forward to celebrating her daughter's milestones in life, author and also a corporate woman as well. My bad for not saying that earlier, Miss Tyrene Gibson. And
thank you.
so as you applaud Miss Lee, you're applauding
Oh,
really.
yes.
This is something that you want to see for your beautiful daughter Anya.
Yes.
And do you have your book cover? I see the cover in the behind you. But behind you is your, do you have your book up? Because your book is Mothering the Crescent Moons. And it
Yes.
is such a good memoir, more special, so special than just good, about your struggle as a mom with a daughter with sickle cell disease. And so I want to give you an opportunity to introduce yourself and your educational background. And Miss Anya, where is she?
Aya's not here at the moment.
Well, she's in school.
But so my name is Tyrene Gibson, and I am the author of Mothering the Crescent Moons. I went to school in London for fashion and business.
Mm-hmm.
And then after studying abroad, then I came back and went to Baltimore and then moved to New York so that I could work in the fashion industry because that was my passion.
Mm-hmm.
And I ended up working for Ford Modeling Agency as a television agent with Screen Actors Guild, negotiating contracts for models for TV, commercial, and film. And I worked for 10 years there. And then I moved on once I became pregnant with Aya, changed my career, and that's how I got started.
Okay, so tell us, Miss Aya, you knew you had sickle cell trait. Is that true? Before you conceived, did you know that?
No, Aya's not here.
No, you yourself.
Oh, yes, I knew that I had the trait.
You knew you had the trait, and so this is important. So we all have. This is like. So Erika was describing the situation where in the 70s we didn't really have a lot of information, and then you have your family has to get educated. But you, of course, knew.
I knew from my pediatrician. My brother and I were told by our pediatrician in Baltimore, since we grew up in Baltimore, that we had the trait. And I knew that the trait came from my dad's side of the family because he had indicated that his mother carried the trait. So that's where it came from on my side of the family.
But you were well informed about sickle cell trait. And so I read in your book, though, during your pregnancy, I think during the amniocentesis part, that you were made aware that there was something going on with your baby in utero, and that you found out your baby has sickle cell anemia, that you knew your baby would have sickle cell anemia. Is that my understanding in the book?
That is correct. After my amnio, I was told that my daughter would come out with the sickle cell disease.
And so, take us back to that moment as a young mom trying to process that, because again, you've lived with sickle cell trait, and let me be clear that sometimes people with sickle cell trait, they can actually have experiences like a full sickle cell anemia patient. If they're really severely stressed, really dehydrated, fluctuations in temperatures, they can behave as a sickle cell full disease, so we have to understand there's a spectrum there as well, but you knew that your daughter would actually have the disease.
I mean, growing up, I never had any issues or problems with the trait. So, and I never knew anyone that had the disease. No one in my family that I knew, and none of my friends growing up did I know anyone that had the disease. So I really didn't know what to expect when they initially said to me that your daughter is going to come out with the disease. And my gynecologist and OB/GYN, said that he would give me literature, but I should also speak to a doctor that specializes more in hematology and oncology, and also interview a pediatrician, since I was going to be having a baby that had the disease. And then that's when I started my journey.
Okay. And so, I noticed that, like I said, both of you had a lot of support, seemed like from the beginning. You had families that kind of knew this was in the family and into the genes, and the families kind of was like ready to educate, ready to support both emotionally and medically. And we know that there are some families that really just don't have that support. And I worked as in the Sickle Cell Treatment Center at Grady Hospital. We have these, centers of excellence in different areas. Philadelphia has one, Houston has one. And so for young physicians like myself at that time, really up close and personal, dealing with the need for hydration, or the need for a patient to be admitted, needing higher and higher doses of morphine for pain control. And then sickle cell patients at a certain age will also be able to tell you what helps them, and this is where we get sometimes this issue of autonomy and discussion about how best to treat the sickle cell patient, when it's really the patient that understands their disease best. And so I got from the book that you were ready to protect your daughter as she went through these phases. You knew what to expect, but then you also said it broke your heart on so many levels when she did have a pain crisis. That came across so clearly. Do you want to describe that? You describe it so well in the book.
I just really felt kind of useless. A parent never really wants to see their child ever in pain, especially pain that's so crucial that they're just, a lot of times she just didn't, I felt like she may die. She didn't want to necessarily deal with the pain. She didn't want to go, further. So it was really difficult to try to alleviate some of that pain for Aya.
And so as a baby, did she have a pain crisis?
She didn't have a pain crisis as a baby until the age of 3.
But that's still very young to be going to the emergency room where you felt like people were really moving in slow motion.
Oh yeah. And then she didn't really know what was going on with her body. Because at 3, you don't really understand what's going on.
Right. I tell parents, babies are really honest. They don't have the concept of secondary gain. So if they're not walking on their leg, or they're not wanting you to touch them, there's something going on. Not every baby's going to cry and scream. Some babies get still, but when I deal with educating younger residents, I said, you have to really look at a child at this age, because they don't want morphine. They don't even know.
Yeah, they're like, what is that?
Yeah, they want to feel better. So you have to realize this, think about that when that child is very sick or comes to you in the emergency room to do your evaluation, and think very critically about how they are presenting to you. And I heard, in the book loud and clear that you really wanted to, yell and scream when it felt like, people were really moving in slow motion. But I love
because they would come in and go out and, I'll be right back. It'll be 30 minutes later. It's like your child's in pain. And I was afraid of needles. So then when they wanted to start like IVs, it was a whole big production. We're trying to get the IV in. So it was just like, okay, well, when are you going to be back?
Yeah. And I trust and believe. I've had moms and dads be furious. I couldn't move fast enough. And, you were multitasking, not to make excuses. But there's something that I want both of y'all to basically express. And that is, how would you say that someone with sickle cell disease or a parent should be received by the medical community, let's say in the emergency room, what is one thing that you want us to know? And I'm a physician, so I want you to tell me, say, if I wish you guys would do what? Erika?
I wish you all would keep in mind that sickle cell disease, the pain is outrageous. And the sooner we can have an IV in, even just with hydration, the sooner we can get an IV of sodium chloride in, that helps a lot. Even if you cannot give us the actual pain medicine, but if we could go straight to the back after you're in the emergency room, get started on the sodium chloride, it would help big time. And it would help big time if we're not perceived as drug users.
Okay. And Tyrene, what would you say?
For me, I feel as though every emergency room should have a protocol for sickle cell patients. As soon as they come in, they should not have to wait for long periods of time. They should take them back immediately and get them hydrated until a doctor can see them. If they're coming to the ER, that means that they're in pain. They need help.
I think you both touched on it. And Tyrene, I know that you've been involved with medical education. You've been going around doing grand rounds anywhere that our academic
allow me
that have been allowing you to come in. And this is also during COVID that you continue to say, as soon as COVID is over and I'm allowed to speak to your residents, please let me do so. And I think that that's a good to know, because this could be a protocol-driven presentation. We have that for heart disease. We have that for people with emphysema. I think that, when we think about on a larger scale, we say that in America, maybe 100 to 150,000 patients have sickle cell disease. Therefore, if you bring them over, across the US, maybe it's not as a big of a deal, but to families like you and to you, Ms. Lee, this is a big deal. And I think that it should be a protocol-driven approach. It certainly would not hurt anything, and it definitely would make families and people dealing with sickle cell disease feel like they are being cared for. In my course of 20 years of being in medicine, we had the crack epidemic, and then we have the now we're having battling with overdoses with fentanyl, and we are so we had this war on drugs, that's been continual. And there is a researcher that has been writing about this whole concept of sickle cell disease, Keith Walu, and he has written about this whole how pain is perceived, and it's a political discussion, and that we have chosen to withhold and give, but there's this whole conversation about how are we doing this, and then where does a sickle cell patient lie, because we know that's what you need. And I think it's an ongoing discussion, and advocates like yourself really help us in the medicine understand that we have sickle cell patients and we're here and we need to be counted.
And there's one more thing I would like to mention. I also would like help with doctors and nurses, is that every patient with sickle cell is different.
Yes, and
even though I know that there are protocols on how they treat them, they have to know that every patient is not the same.
I agree, but you both agreed that step one is that we need better education. Step two, maybe a protocol for the presentation, and that presentation uses. And I think we're all agreeing that hydration, and immediate attention is what's needed. And then after that, I do agree that every patient responds to pain medication, because we all have different cells differently, right? How you respond to Demerol or morphine is different from your child, Anya, and different for you, Ms. Lee. The question I have now is for you. Describe to me, Tyrene, your daughter got a cure.
Yes.
But the cure is what? And you say something very telling in the book, and that is How sick does she have to be to qualify? So take us there. And that's important.
I mean, when the doctor initially had said, your child isn't sick enough, I wanted to flip out. I said to myself, what do you mean? How sick do you need to be in order to go through a transplant?
So you
and at that time, they didn't feel as though that she had enough pain crises at that time that were severe enough to be a part of going through a bone marrow transplant.
Well, tell me about the pediatrician who said, wait, she's having not just pain episodes, she actually gets a secondary illness. She's getting pneumonias. And is that what qualified you for the transplant?
No, what qualified Aya for the transplant was that the last pain crisis that she had, it was severe. It was severe enough that she had to go to the ICU, and she was in there for like a week.
Ms. Lee, did you ever have to go to the ICU?
No.
So everyone is different. Yes. Okay.
Yeah.
And did you take methotrexate or any maintenance medication?
I did not.
Still
do not.
And so, and you, Tyrene, decided that, my daughter needs not just a bridge. And I love what you say. You wanted a treatment. And I love that Aya said to you, Mommy, I want a cure.
Yeah, she was the one that really pushed the doctors. I was the one that said I did not want her to be on pain medication for the rest of her life, because I just thought that was a Band-Aid and it wasn't going to cure her. And I didn't want to see her just on a drug for the rest of her life.
And so how was she when she said, I want a cure? Because I thought I put a question mark by that.
How old? She was 9 or 10.
And see, someone say, oh, no, she couldn't do that because she's too young.
Because we would hear the doctors talking to other patients, talking about transplants. And she was like, why can't I get a transplant?
Good girl.
But see, this is what I want people to understand. She's been going to and having episodes since she was 3. So she's not naive to the healthcare system. She's not naive to this environment. And it's like when I see cancer patients, cancer children, they are super, super smart. They can tell you what veins work. Don't give me that. I didn't like it. And you have to listen to them. They know. And so I wanted you to tell me for real that she was actually between 9 and 11, but it's about 12 when she got her transplant.
Yeah, it was August 1st. So she was 11. Her birthday was August 22nd. So she really would have, been 12.
Okay. But there is something that Erika, you're passionate about, and that you said there are some economic challenges with sickle cell, because I think that Tyrene also alluded to that in her book as well, that we can all need to kind of point out there's some economic challenges and health disparities there. Do you want to elaborate on that point?
Sure. Unfortunately, you see that across the board with a lot of things, but especially with sickle cell anemia, since it primarily affects the Black community. Depending on where you live, there may be good hospitals in a downtown setting. But depending on your situation, if you don't live nearby, it's hard to get there. You miss time from work with this disease. It could definitely be an economic, financial burden on you and your family. Unfortunately,
it was for me.
Okay, right. Unfortunately, we don't have good centers in every neighborhood.
Right.
Where they should be.
Right. Even if we do, another way that we exclude people are the hours of the centers.
Oh, I never thought about that.
You know what? I only thought about it because at work we had diversity and inclusion training with, I want to say, Dr. Kevin Thompson. And that was one of the things he pointed out. If you're going to be inclusive truly,
Looks at.
yes, looks at all of that. You want it to be accessible,
Mm-hmm.
physically accessible, or location wise, distance, I should say, time wise.
Mm-hmm.
If you're a parent and you work one job or two jobs, whatever the case may be, if I'm working all day, it's harder to get my child to a
Mm-hmm.
center. I'm gonna have to take off to try and get them there. Uh, I may have to take public transportation. My child already does not feel well, so now I got to get them on the bus
Mm-hmm.
to get to wherever the place is.
And
And
when we were in the hospital, they would have patients that were there alone, that their parents had to go back to work.
Yes.
And they didn't really have anyone advocating for
Right.
them. And oftentimes I would feel terrible about that because, these are children. They need to have an advocate.
Even if they're teenagers, they're young and their children, they need to be supported. I think that, we talk about the social determinants of health, and we're also exploring more issues in terms of infrastructure as a determinant of health. And I think that's what you're talking about, Erika, in terms of transportation, in terms of hours, in terms of the community that you serve, that whatever hospital is in the area needs to be responsive to that. And I think that, we have certain ready clinics, fast clinics. Are they prepared to really help the sickle cell family if they were to go there? I think most sickle cell families know to avoid these type of urgent cares, but as we get younger and younger generations, they may think, oh, well, I'll just go there first, and then that will delay their care, and then they have to go to a hospital, or they feel horrible because they've been treated as a drug seeker. And
Mhm.
so, Tyrene, what is your thoughts on what we need to do better?
Well, like I just mentioned with the ER, I
Mhm.
would really have patients go to the ER, but I know that they're opening up a lot of centers in a lot of different
Mhm.
locations. So setting up a protocol, when a sickle cell patient does come in, and then making sure that they get hydrated, make sure that they have the correct staff.
Mhm.
Because oftentimes, I mean, at some of these centers, do you have someone that is educated with
Well,
sickle cell? Because you may not have someone that really understands how that patient should be treated.
Well, I'll be honest with you. I mean, I think I counted maybe 52 or 56 sickle cell centers across the U.S. Some of them only see adults, some of them see whole life, some of them see pediatrics. So there's a conversation there that the centers that we do have are fragmented.
And if they have the adequate staff that really, is educated on.
Mhm. Well, I think that, you say adequate staff. I mean, overall, the healthcare system is facing some shortages. And that for families like yourselves this is why this is important, to say, okay, the whole hospital environment right now, our healthcare infrastructure has taken a big hit under COVID. I've spoken to a researcher, and hopefully I'll be able to get her interview up soon. But even her lab, in terms of research, has taken some challenges with funding. So that's why it's important for people like yourselves to get out, women like yourselves, to get out here and say we're going to continue to advocate, because we've lived with sickle cell, and I say that you did as well, Tyrene, because you had a child there. So yes, you do live with sickle cell. Your daughter was cured. I think that's where we left off. She had the
Yes.
transplant. I want people to read your lovely, lovely book, but I also want you to tell us that transplant, even though it's not a one and done.
No.
That's what I got. It's like you thought, you're hopeful, but then you had challenges. You want to sum those challenges up?
Well, one of the
I wrote
challenges.
my notes.
Well, she had GVH, which is graft host disease.
With
Um,
Kim Stanley.
yes, so she has some discoloration around in her lips area,
Mhm.
and she had to stay on medication for a much longer period of time because they were trying to wean her off. And every time that they would try to wean her off of the medication, then her body would respond and react. So then they would have to bring the dose back up and then go and then bring it back down again. She also had an infection that was by her port, which had to be taken out immediately because she developed an infection after transplant. So that had to be done as well.
The challenges that I wrote down, you want to hear them?
Yes.
You said your daughter had to be homeschooled.
Yes.
You said that you had to get your mom to come help and you were out of work
Yes.
to take care of your daughter. And you also said that you feared that she would not survive this transplant. Those were all concerns, real concerns for you. So, that goes back to this challenge of the economic impact of this disease. Sometimes people may not understand, the pain. They may not understand having a sick child, but most of us can understand looking up and saying, I'm broke. I don't have the finances to live the American dream, housing, food, clothing, transportation, and now add on that a chronic disease. But you withstood all of that. I think both of you all survived, some of the major challenges.
And I had to fight with her school as well.
Yeah, you have all those fights.
For Skype.
Yeah, you have to fight with the school. So where's Anya now?
She is at a restaurant right now.
Like, where is she in her life now?
She is studying at Loyola University in New Orleans.
Yay!
She's in her senior year. Expected to take her MCAT in January.
I love it. All right.
Graduating in May and hopefully going to medical school.
All right. So talking about all the stages of life and you get to experience them. I don't want to tell some of the things of the book. But what I want to say is that your book is very inspiring. If you move your head over to a little bit, there's a beautiful picture, and that's the cover. And I couldn't think of another one that's so beautiful to me and inspiring. So, we want sickle cell patients to experience the joy that you found. We're still working on that cure. And you can sit up straight. We got you now. But we're still working on that cure. We're still working towards finding the formula that that can cure sickle cell. Pediatric patients, we have more successful transplant cases than when people become adults. Some of the protocols require that patients be really, really sick. And if they're really, really sick, then as you describe in the book, the process of getting that transplant can be fatal. That is very real. And then we talk about the need for more social and economical support for families with sickle cell disease. This is important. And I think that, corporations, is that us? Corporations and other entities can chip in and understand that we can take a cause. Now, two things that we need people to do, our calls of action, call to action would be bone marrow transplant registry.
Yes.
Tell me about what that entails.
That entails of getting signing up on the Be the Match or any type of bone marrow registry. They generally require for you to be the ages of 18 and 40. They also would like a swab, so you have to they'll send you a kit and you swab in your mouth and then you send that back. And that's basically how they put you in their database. So whenever they need a donor, then they would be able to reach out to you to actually come in for additional typing.
That didn't sound painful.
No,
That's
not at all.
It's not painful. And so we actually need more African Americans on this registry. We need our communities to get involved in this process. And again, that did not sound painful. So I will be joining this registry. I had some fears about it. What's another thing that we need, Ms. Lee? What is something else?
Blood donors.
Blood donors. Okay.
Yes.
We got now that COVID is over, hopefully we can get those numbers up, and we definitely need to understand with the unsurge of our communities with gun violence. We also were given plasmapheresis with COVID, that patients who get affected were our chronically ill patients that sometimes have cancer and anemia, but
Mhm.
also our sickle cell patients had a situation whereby they were their care could be delayed from not getting blood transfusions, and also not having ability to get access to the emergency room fast enough for said blood transfusions. And our American Red Cross definitely has needed to refill their stores for blood and stored products. It's not just blood. There's other products that we use with the American Red Cross. So anytime that, this is not, even though we call this Sickle Cell Awareness Month,
Yes.
guys.
I wanted to say a couple of things also.
Yeah, please, please.
Regarding another reason why I wrote the book is I wanted to make sure that we have these conversations. Oftentimes, you always hear about cancer, you hear about leukemia, but we don't hear enough about sickle cell anemia. With me, I always felt it was always put under the rug, kind of like shoved to the side. Oh, yeah, 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 yeah. I want it in the forefront. I would like to see more people talking about it. Let's have these conversations to make sure that you know whether you carry the trait or not carry the trait, so that when you hook up with a partner, you know whether that partner that you potentially could have a baby with, if you decide to stay with, what traits do they have, so that we can help to stop a child to come out with the disease, hopefully. Also, is to educate our clinicians, our doctors, our nurses, with their training and how they're being trained regarding sickle cell patients. So those are some of the things that I would like to see happen.
Erika.
And two things to your point. We talked about transportation earlier, and you're right. Other diseases, definitely cancer, they have programs. Well, if
Yes.
you need someone to come pick you up, to take you to get a treatment, and it would be great if we got to the point that we had things like that. And education, of course, is always the key. Dr. K,
Yeah.
speaking of our wedding, that was something we chose to do for our wedding. Instead of spending money on the little gifts, I can't even think of the name of it.
Souvenirs.
Thank you. We donated $1,000 to Sickle Cell Anemia Foundation, and then at the actual reception, we had pamphlets out about it.
Oh, that is so special. Yes.
And we wrote a letter that was framed stating, it didn't say it like this, but no, we're not having the souvenirs.
Yes.
If you would like, you could donate to Sickle Cell Anemia Fund. And we talked about in the letter what it is. We had statistics in the letter. Now, granted, the people that's at our wedding, the majority of them know us very well. So they knew that that was a big thing to us. But other people, people dates that may not necessarily know us and don't know our situation, we felt was a good way to educate the guests.
Oh, definitely.
Yeah. I think that is absolutely the best way to kind of have it into the everyday activities of our lives. And I think that, again, whether I'm just bumping into you at a ball, Erika, and you was like, and I thank you for sharing that you had sickle cell and you didn't stutter and you didn't say, kind of make up something. And that was, even if I didn't have this platform, I thought that was such a powerful thing to do, to share that you were experiencing something as another Black woman, and I could pass it along. You didn't know I was a physician. And so again, it was just a matter of sharing. I think that's what Tyrene is talking about, is that we definitely need to understand that sickle cell disease is real. There is someone in our midst that may have it, and it would behoove you to understand it. And because you never know who else you might know, and lo and behold, it's in our community to be talked about. although we have mandatory testing, I think what you all are emphasizing is we do have mandatory testing for the trait, for the disease at birth. Okay, I
But
think
people don't talk about it when
right,
they're dating.
right. In the 60s, we made that mandatory. I think Nixon made a rule about that. But what you're saying is beyond that, you take this information as a family, you either don't discuss it. Your families were also very educated and discussed this matter with you all. But again, we have to remember to, as we get, generations and generations of kids, to say, don't forget about this disease. And then these families can feel isolated and as if they are kind of forgotten and not supported in the Black community. And they're going in and out of emergency rooms. And as you keep emphasizing, Tyrene, I know that's your passion to say, I don't want them to meet a physician that does not understand this disease. It is not an antiquated disease. It is a now disease. It's still something that needs to be discussed. When I was in medical school, it was discussed. I knew what it was. And so when I dealt with patients, I was already educated about it, about the process. But I will admit that I did have colleagues who were not. And we were dealing with a heavy crack epidemic at that time. So as we are addressing our current drug situation around the nation, we have to remember that there are patients that the treatment is for the pain, and that does require pain medication and hydration, care, and compassion. How about that?
Yes.
So listen,
Yes.
any parting words, and I'm gonna decrease you, at Tyrene, and I want you to tell us one more thing, Erika.
Well, actually, picking up from what you just said, I had an experience in Chicago this summer and a crisis like I never had before.
Situation. Go ahead.
Had a crisis like I never had before. Went to the hospital. This particular hospital had an actual sickle cell anemia center there. I had a white nurse practitioner, and she and I was speaking about the disparities. And she had an interesting point. She was saying that you're right, we're treating the disease and the people should not be looked at drug addicts. She said, but guess what? Even if you look at them, they need the medication. And she said, I really just think since we're more blended now in the US, we have a lot of multi racial relationships. She said it's more of the multi-relational relationships produce children that are sicklers. She thinks it's a shame, but she thinks it will be looked at differently.
That's, you know what? That's a very good point. That's a whole nother show. We're gonna have to have a part 2. And I'm not going to dilute what we have been talking about this evening, your personal accounts, but I would like to talk about that as we continue to build on this conversation for sickle cell. How about that? But I do want I want to end on that note. That's a very important issue, is that how does this become a crossover disease?
Right.
It is becoming a crossover disease. And if that happens, do we get more attention to it? And that is a very good point. It's a very good question. I'm going to add Tyrene, and I'm going to decrease you. And oh, look what we got.
I want to make sure that everybody goes out and get a copy of my book, Mothering the Crescent Moons, wherever books are sold, on Amazon, Barnes and Noble.
And I just want to emphasize, it is, again, just a beautiful, beautiful memoir. It's not fancy. It's easy to read, but it's so heartfelt that that's the reason that it's a #1 seller on Amazon. I think that I want to thank you personally for just writing the book, to feel like you needed to show us, to share with us your struggle and how you cared. And I just love it. I really do. It's such a beautiful book. So I look forward to talking again with you both.
Thank you, Dr. Adler, for having me, especially during Sickle Cell Awareness Month.
Absolutely. And like I say, for some of us, some diseases are every day. It's not just a month. And so I do look forward to meeting Anya. I do look forward to seeing you again, Erika. I appreciate you for
Thank you.
invitation. And so we're going to end the program. And thank you both so much for your time. Again, it's Sickle Cell Awareness Month. And for some of us, Sickle Cell Awareness is every single day. And thank you for your stories and caring and sharing with me as a physician.
Thank you for the platform.
You're welcome. You're welcome.
Thank you for having us.
You're welcome.